Welcome to this presentation. This presentation is about how to become a psychiatrist in UK. And this is specifically for the international medical graduates or the medical students who are interested in becoming a psychiatrist and coming and to UK and work here. So let us start this presentation. The learning objectives from this presentation are basically the commonly asked questions I get from the international medical graduates. First, we will talk about the basic understanding of how psychiatry training work in UK, how psychiatrists are made in UK, basically. So then we can talk about opportunities available to the international medical graduates and how can we enter those training pathways. Then we will also talk about training and non-training jobs as well, because you may hear that, there are some training doctors, there are some doctors who are working on non-training grade jobs as well. People get confused about the future of non-training jobs, and they may ask, what will happen to those doctors, what will be their future, and we'll talk about that as well. Then we will learn about some common terms which you may hear on social media or read here and there from on the website, things like MTI, CSER, ST training, CT training, certificate C, press form, MSRA exam. So what are these things, and how do they fit in the scheme of psychiatry training, and why are they useful for, where are they useful for the international medical graduates? And I'll try to explain them to you. A disclaimer, very simple, I am recording this presentation in March of 2023 with the best of my intention and best of my knowledge. And the pathways I'm talking about is valid for this round. But things change. The criteria of recruitment, the criteria of GMC registration might change in the future as well. So the authority you must remember is the GMC and Royal College of Psychiatry, and they have websites. They have information on their website as well. They are the relevant authorities. And if you're finding any information I'm giving you which is contradicting to what you read on GMC and Royal College websites, please trust them, not me. And then last thing I'd like to say that I will talk about the most common pathways which I see people taking international medical graduates, but that doesn't mean that that's the only way, because there are several variations to every pathway, and every IMG will have a unique journey to UK. So let us start the presentation. So the first thing I like to discuss is the psychiatry training in the UK. So how do we actually make psychiatrists in UK, and what are the local graduates doing? So local graduates, simply speaking, graduate from a medical university. Then what they will do is something called foundation years, which is same thing as an internship or house job, which we do back home as an international medical graduate. But foundation years is important to note in UK are for 2 years, rather than the internship, which is done internationally, is normally for 1 year after graduation. But in UK, they work for 2 years and at a foundation level, and as a foundation doctor, FY2 will then think about becoming a psychiatrist, and then they will apply for the core psychiatry training. The application for the first round, there are 2 rounds of core psychiatry training. The first round will normally open in October. They will start taking the application in October. They will have the MSRA exam, which is an entry-level exam, to be done, and that will be done around January. This has been happening for the past few years. The job will then start in August round, and then the round 2 will normally start in summer, June or something like that. The application will be asked to be submitted. MSRA will be in September, and those round 2 jobs will start in February. So what is MSRA exam? I think just very simply, MSRA is an entry exam, is a recruitment exam, which is not specific to psychiatry. This exam is taken by a different subspecialty. It is done for general practice, core surgical training as well, radiology training, for example, and some other specialties as well. So this is not a specific psychiatry exam, but this is a generic exam you do. Based on the scores of that exam, you will get a ranking that this many people have applied, your rank is so and so. And based on that ranking that you will apply, then you will rank different places. And then based on that, you will get the core psychiatry training. Now, core psychiatry training, or you can say psychiatry training in UK, is divided into 2 different stages. Core training is the lower training, you can say, and the ST training is the higher training. During core psychiatry training, you have to pass your MRCPsych exam as well, and that will make you eligible to apply for ST training in psychiatry. I'll talk about what are the requirement right now to go into ST training, but basically CAS is score as required, your portfolio as evidence of portfolio required, and there's an interview as well you have to do to apply for ST training. Remember, to enter the core training in psychiatry is only the MSR exam. There's no interview stage, there's no portfolio. You don't have to show them any evidence that you have done something in psychiatry. You may not have any experience in psychiatry, you can still apply for on this stage. But you have to pass the MRC Psych exam, the full exam, and then you have to apply for ST training then. Then at the end of the ST training here is shown for 3 years, but it could be longer than that as well. You get something called CCT, then you can apply for a consultant position. About this picture, I just like to say one more thing. This looks like a very straightforward path, but a lot of the people will not follow it so straightforwardly. Like for example, even the UK graduates after the F2, the foundation 2, they might not directly apply for core training. They might take some non-training posts, might do locums, might go abroad, take a year out or 2 years out. Same in the core training as well. It is for 3 years, but some people will take longer. Sometimes people might not be able to pass the exams on time, and they will have extension of 3 months, sometimes 6 months, sometimes for 12 months. Some people will have other issues like, for example, childbirth and all that. For that they will have some gap as well, and they might take a bit longer. Same with ST training, it's just showing 3 years there, but sometimes people are doing dual training. Sometimes they're taking some time out of training as well. It can be longer than that. Then finally, at the end of ST training, you get a CCT, and then you can apply for the consultant post in UK. So this is the same diagram I've done again, to simplify that. Medical university normally for 5 years, foundation year training for 2 years, core training in psychiatry for 3 years, ST training for 3 years. It could be longer than 3 years as well, and then CCT. MSR exam to enter core training. Then you have MRC Psych exam to be passed in the core training. Then you apply for ST training, which will include the CAS course, MRC Psych exam. Final part is called CAS scores for that, the portfolio you have developed so far, ranking on that, and a small interview. Then you can apply for the ST training. Based on those, you get a mark scoring, and then you can apply for ST training. Now, the points to note about psychiatry training in UK is that, which I've already explained, psychiatry training in UK is divided, generally speaking, into 2 different stages: core training and ST training. Again, there's a small variation here. There are some small number of posts, run-through posts for LD psychiatry and CAM psychiatry as well. When you don't have to have 2 different stages of training. You can have one singular job. But most of the people will apply for core training, then apply for ST training separately. MRC Psych exam is the only exam you take in the training. There's no exit exam. There's no fellowship exam, because that can get confusing for people. But they say that, how will you then know that if somebody is good enough to become a consultant? Because every year when you're in training, you're passing something called ARCP, which is called Annual Review of Clinical Competence, which is basically you gather some evidence on your portfolio that you are gaining experience, getting expertise. Then your supervisor will write some reports as well. So there are some workplace-based assessments, some other evidence together, and then based on that, you pass annual review of clinical competence every year. MSR exam, as I've already explained, is the exam you take to enter into core psychiatry training, and it's a generic exam, not specific to psychiatry. Now, core training in psychiatry, simply speaking, is 3 years of training. Usually they are rotational posts for 6 months, and every 6 months you rotate to a new clinical supervisor, and you rotate to a new placement. Like when I was doing my core training in psychiatry, I did 6 months of general adult, 6 months of general adult. Then I did old age psychiatry for 6 months, child psychiatry for 6 months. Then I did rehab for 6 months. Then I did forensic psychiatry for 6 months. So they were all rotation posts. Every time I was changing my posting, I had a new clinical supervisor, but my education supervisor remains the same for the whole 3 years. The rotations in different subspecialty psychiatry, so you get a taste of different subspecialty while you're in core training. Trainees maintain a portfolio which is online, and we passed our annual review of clinical competence every year to pass every year. MRC Psych exam is expected to be passed by CT3 year. Then you'll be eligible to apply for ST4, which is the next level. If you don't pass the exam, you might be asked to leave the training without the exam, but you will have the core competencies other than the exams, or you might be getting an extension. The common myths about core training, a lot of people ask this question that I don't have any psychiatry experience so far. The only experience of psychiatry I have was in medical school. After that, I haven't worked in psychiatry at all. Can I still apply for core training? The answer is yes. Sorry. The question here is inverse. Do I need psychiatric experience to apply in psychiatric core training? No, you don't need any experience of psychiatry. This is not an essential criteria at all. To apply for psychiatric core training, you may not have any experience in psychiatry, and you can still apply for psychiatric core training and pass the MRCPsych exam and then get your position. Do I need to pass MRCPsych exam to enter the training in psychiatry? To enter the core training, the exam is MSRA, not MRCPsych. You don't need MRCPsych to enter. This is a confusing area because, I know if you are working in India or Pakistan, I know in Pakistan at least, if you're doing FCPS, you need to pass FCPS Part A to enter the training. But in UK, you don't need any MRCPsych to enter the training, but you do need to pass the MSRA exam, which is separate, which is not psychiatry related. Let's come to psychiatric training. As I said, once you have done psychiatric core training, which was for 3 years, different subspecialty psychiatry, pass your MRCPsych exam and your ARCP. Now you're ready to apply for and get the ST training in psychiatry. ST training in psychiatry is the higher level of training, and here you are specific to subspecialties of psychiatry. 3 years at least, and it's going to be longer if you're doing dual training. So the subspecialties of psychiatry, in which you get separate CCTs, general adult psychiatry, old age psychiatry, child psychiatry, LD psychiatry, forensic psychiatry, medical psychotherapy. So these are 6 different CCTs you can get if you're doing singular training, but there are dual psychiatry and ST trainings as well. So if you don't want to restrict yourself with one specialty, you can do a dual specialty. Very commonly, people do general adult and old age psychiatry. Other than that, you can do general adult forensic psychiatry, mixture of that, general adult psychiatry, medical psychotherapy, child psychiatry, medical psychotherapy, different combinations you can see. And they will be advertised when the posts are advertised. But generally speaking, you will find that the most of the posts would be singular specialty, and there will be some dual training. So the competition of dual training posts are generally more, but then you are spending more time in dual training as well. So like, for example, this first one, general adult and old age psychiatry, would be for 4 years, not for 3 years. I know medical psychotherapy with general adult psychiatry, that could be for 5 years as well. So, you are compromising in the sense of time, that you're spending more time, but then you will get a CCT, which will be a dual CCT. You will be an expert, be counted an expert in 2 different subspecialties of psychiatry. So after you've got your CCT, you've done, finish your training, you become a consultant psychiatrist. Now, again, this is important to understand. To become a permanent consultant, which we call a systematic consultant in psychiatry, you need to be on the special register of GMC. So how do you get on special register on GMC? You get by CCT, which is the training pathway. You've completed your training, you at least completed your ST training in psychiatry, you get CCT. If you are going to non-training pathway, you haven't done training, but you can prove to the Royal College and GMC that you are actually good enough, your skills and your knowledge is good enough to be on a special register, then you can get the CSER approved. And that CSER is part of this presentation. It will come by the end of this presentation, but I just like to tell you that this is how you become a consultant. Then you need to be on special register, and these are 2 pathways to get on special register. But then you will also find doctors in UK who are working as locum consultant who are not on special register. They are basically given those locum consultant posts based on their experience in psychiatry. So this is another non-training pathway I'll talk you through in a minute. So now come to the main body of this presentation, that if you are an international medical graduate, IMG, and you want to become a psychiatrist in UK, what are the different pathways? What can you do given your experience and different levels of training you've seen? When and where can you enter? So let's come to the IMGs. The first thing you consider when you are thinking about UK is that route to GMC registration, because to work in UK as a doctor, you need GMC registration. So by understanding those routes, you will see the different pathways as well. First route, very, very simple PLAB route, which I did myself. For junior doctors, if you are at the level, you just done an internship in your home country, and you've got a few years of experience, and you're not a specialist yet, you're not in training yet, you can consider the PLAB pathway and come as a junior doctor. Then there's a membership exam pathway as well. So if you pass membership exam, MRCPsych, not just one part, but the full exam, Then after doing the English exam, English competency, showing the English competency, IELTS or OAT, you can apply for GMC registration and you will get the full GMC registration with that. Then there's a thing called MTI route, and I'll talk you through that. MTI is Medical Training Initiative. You don't actually need to pass any exam, but this is MTI schemes run by Royal College of Psychiatrists. You apply for that. If you get selected, then you will get your GMC registration sponsored by the Royal College. Then there's a sponsorship route as well. I mean, this is confusing. Sometimes people can say that if MTI is a sponsoring route, then why is a separate sponsorship route? So the separate sponsorship route is basically a trust or NHS body directly sponsoring you, and they feel that your skills are good enough to work in UK as a doctor, so you can bypass all the exams like PLAB or MRCPsych, when you can still get the GMC registration. And I'll talk you through that in a minute as well when I discuss those routes. Then there are some other acceptable exams which you get you GMC registration. For example, if you have done other Royal College exams, Royal College of Physicians, MRCP, MRCS, those will also get you GMC registration as well. There are people who have done actually MRCP. I've met a few who came to UK through that route. Then you don't have to actually work in medicine if you got registration once. And you can change your mind and join psychiatry. Some people have come through that route as well. Then there are some other exams, like if you've done US Assembly up until 2020, you can apply for GMC registration. If you've done Australian Medical Council exam, then you will get GMC registration as well. Again, you can enter the system through that. So let's talk about the PLAB pathway, and this is recommended for the junior doctor. If you're a junior doctor, this is the best thing you can do. I came through this pathway as well myself. So PLAB, as we know, is an exam taken by the GMC for the licensing exam, and after you pass PLAB 1 and PLAB 2, you will get the GMC registration, full GMC registration. So again, this picture I'll show you about where are the PLAB candidates fitting in this competency or this training pathway. So obviously, we're not UK graduates. International medical graduates would have done 5 years of medical university in their own country. Then internship we have done, which is kind of equivalent to the foundation training, but may not be for 2 years, maybe just for 1 year. You might need some more experience after that 1 year to get your CREST form signed, which is the foundation competency form signed, and then you can apply for the core training in psychiatry. You can aim for this. So if you are a PLAB doctor with not that much experience in psychiatry, you can aim for this route to enter here by taking MSR exam and start to enter the core training in psychiatry. So this is the route, clearly, very simply explained. You've done your PLAB exam, you got your full GMC registration. After that, most people don't directly apply for training. You can technically directly apply for training, but most people will apply for non-training job in UK, and that doesn't need to be in psychiatry. That could be any specialty. I encourage doctors, junior doctors to explore. Even if you have made up your mind that you want to become a psychiatrist, try and explore other things as well. As a first job, just try and get in the system. Try and find any job, could be in medicine, accident, emergency, surgery, anywhere. Start a non-training job in UK as a junior level. Get your CREST form signed. CREST form could be signed in UK or it could be signed from abroad. CREST form is basically the foundation competency form. You are basically, by signing this form, your supervisor is saying that they are satisfied that your level of competency is same as what they expect for a foundation doctor. Then based on your GMC registration and the CREST form, you can apply for core psychiatry training. And as I said, once your application is approved, you will be invited to take the MSRA exam. So a lot of people get confused about MSRA and they say, can we just book the exam and take it like we take other exams like PLAB and all that? No, MSRA is actually not like that. MSRA, you get an invite once your application is approved for training and they have longlisted you, then they will invite and then you will take the exam. And those exams happen on a fixed window. As I said, they happen in January and also in September so far. They might change in the future, but these are the 2 times they've been happening. After you've done your MSR exam, which is the generic exam, based on those scores, you will get a rank, and then you will rank your application against the available postings, which are all across UK for psychiatric core training, and then you will get psychiatric core training. So this is the pathway for a junior IMG who's coming through PLAB. Most of them will follow this pathway. Some people will try and skip this part of non-training job. They will get GMC registration, get CREST form signed from the home country. CREST form doesn't need to be. So far, they are accepted from abroad as well. and then directly apply for psychiatry core training. A lot of people will say this is not recommended because you might find it's too much, too overwhelming if you have no experience of working in UK. So it is advisable to try and do some non-training course if possible. So psychiatric core training eligibility, as I said already, foundation competencies, the CREST form, they're just list of competencies your supervisor can look into and sign. Could be signed in UK, could be signed abroad. You didn't have to work for that supervisor for at least 3 months. Then you need 24 months of total experience following graduation as a doctor, including your internship, and that could be in any specialty. Now, when a lot of junior doctors read this, they get confused. They think maybe it means that you need 24 months of psychiatric experience to apply for training. That's not true. That 24 months basically is to match what the local doctors do here. Local British graduates, they do foundation training, that is for 2 years. So if you only done internship for 1 year, that 1 year you can minus, and then they expect you to have worked for another year, but could be anywhere. It doesn't need to be a foundation post. It could be anywhere, any specialty within UK, within your home country. So if you have worked as a doctor after your internship anywhere, those months will be counted towards 24 months, and that 24 months need to finish or till by the time you're starting the job, not at time of your application. The application might be in October, and the job will be starting in August. So they will be expecting you to at least have done 24 months post graduation in any specialty as a doctor by the time it's August. So this is just for psychiatric core training. Now the second pathway is important. I think this is especially for experienced psychiatrists, and this is called MRCPsych pathway, getting GMC registration through MRCPsych and then entering UK through that, entering training and all that. I'll explain that. I will recommend this pathway to the trainees who are working in the home countries and thinking about UK. So if you're FCPS trainee, if you're MD training in India, FCPS training in Pakistan, or if you're doing training in psychiatry in any other country you're watching this video from, consider doing MRCPsych while you are in training and doing your own fellowship or postgrad exams, because that will give you some advantages. Now, MRCPsych exam, if you have done that exam as you're an experienced psychiatrist already, you can bypass the core training in psychiatry. You can bypass the foundation training. You can bypass the core training in psychiatry. You don't need to take MSR exam. You can enter here if you have passed the full exam and aim for the ST training in psychiatry, which is for 3 years, and then you can become a consultant in UK. The way so far the application are ranked, it's ranked by CAS score. CASC is the final part of MRCPsych, your portfolio, then your interview. So portfolio, your evidence of your achievement so far, they've asked you to rank them, and there's some marking and some criteria for that. And there will be a small interview. And based on all those 3 things, you will get a final score. And based on that score, you will get the ranking, and then you will rank the different posts, and then you will get the ones you're ranked for. Now, this is the pathway. Simply, there are 3 different pathways, 3 different types of pathways MRCPsych doctors can take. So if you have experienced doctor in psychiatry in home country, you have passed MRCPsych, you get GMC registration by passing an English exam. Then you will get certificate C signed. Certificate C is basically core competency certificate, which means that your supervisor is signing to say that your skills are good enough to be a core training in UK equivalent. And then by signing that form, you are basically bypassing the CD training in psychiatry, and then you're directly applying for the ST training in psychiatry. These things, MRCPsych GMC registration certificate C will make you eligible to apply for the ST training in psychiatry. Then obviously you have to go through the process of the portfolio and the interview to actually get the post. But this is a pathway a lot of psychiatrists are using now. I've known a lot of people from India and Pakistan who have done their MRCPsych exam while they were training there, and then came to UK, get their certificate signed, get their ST training jobs, and then became consultant from that pathway. Now, some people will also say that if you have done MRCPsych, what is the other thing you can do other than taking the ST training? Is there other routes? So there are some other routes people take, some variations basically. So if you've done MRCPsych exam, you can get GMC registration, as I said, based on that. So rather than applying for directly ST training, some people will apply for SAS or a specialty doctor post. And these posts are basically middle grade doctors who are working in UK. They're not consultants yet. They are not junior doctors. They are in the middle. They are relatively independently practicing in comparison to junior doctor, but not yet consultant. Their responsibility level is still not as a consultant. These jobs are available widely in different subspecialties of psychiatry. This could be a 9 to 5 job as well, no on calls and no weekends. While working as a specialty doctor post, they can aim to also get their certificate C signed, then apply for ST training and that get their CCT. So by working the specialty doctor post, people can improve their portfolio ranking as well. They can get UK experience as well. Some people think that directly doing MRC psych from abroad and directly going for ST training might make them confused. They might not understand the Mental Health Act. They might not understand the other systems so well. So by doing a specialty doctor post for a year or 2 years or 6 months or 18 months, whatever, they get more experience, more confidence to take the ST training. So this is another variation of the pathway of this pathway you can do. Then there's another two variation I have mentioned here. Some people will do MRC Psych, then they will get GMC registration based on that. Then they'll get the SAS or specialty doctor post, as I said. But rather than going for the form certificate C or ST training, they will go for Caesar pathway. Now, Caesar is another pathway which is separate from CCT. Now, in Caesar pathway, you are actually, I'll talk about that in a minute in more depth, but basically you are trying to prove to GMC and to the Royal College that you have done everything which ST training doctor does on a non-training post, and you are good enough to be on a specialist register. And once your Caesar application get approved, you can become a consultant. Another variation of this is what we call the locum consultant pathway, you can call it. So get your MRC Psych, GMC registration, get a specialty doctor, middle grade job doctor post. Forget about Caesar or certificate C or CCT. If you get enough experience working as a specialty doctor and your confidence level is good and you and the trust or the hospital trusts you, your skills and competence level as well, they can actually directly give you a locum consultant post as well. So locum consultant posts are normally always temporary. So they are not permanent posts as a substantive consultant. But still, you will be doing a similar thing, similar jobs as a locum consultant. Sometimes you can earn a little bit more than a substantive consultant as well. So this is another pathway a lot of people take. So they can actually bypass both Caesar pathway. They can both bypass ST training, CCT, and then directly become locum consultant. But there are some uncertainties about locum consultants as well. Now, this is the certificate C I've mentioned a few times. So this is the you can see they call it core competency equivalence report. This is the latest version of that, which is August 2023. And if you're watching this presentation in the future, there might be a new version. You need to check for that. You can find that from the Royal College website, the recruitment website as well, SC recruitment website. So now you can see certificate C is basically tick boxes to say that the things core trainees do, and in the core training that you have achieved those things. So your consultant can actually tick those boxes for you if they have confidence and if they're satisfied with your confidence level. So the question is, who can sign the certificate C? If you are in UK, it needs to be signed by somebody who is in a specialist register. So they can either have CCT or Caesar. They might be working as a substantive consultant, but sometimes CCT and Caesar doctors can work as a locum consultant as well. So they can also sign this form. But a locum consultant who is not on specialist register will not be able to sign this certificate C. This is something important to note. Certificate C can be signed in your home country as well. So if your consultant is not working in UK at all, they're working in your home country, they can also sign certificate C. They will have to submit their evidence of their registration to the GMC when they're doing that. Now, this is they don't need to be your consultant from your home country. Don't need to have CCT or Caesar. They don't need to be on a GMC register or have GMC registration. But they need to be a senior doctor in the home country. So this is all explained on the certificate C that who can actually sign it. So it's good to sort of print that, have it with you while you're doing your MRC Psych pathway. So you know what competencies are required, if there's any evidence you need to gather, if there's anything you need to do. So I think this is something you should get the printout of and keep it with you to sort of read. MRC Psych exam, a lot of people will ask me that, am I actually eligible to take the exams? If you're working as a psychiatry resident, psychiatry training abroad in your home country, there is obviously pathways. You can take MRCPsych exam, but if you want to know the specific eligibility criteria for different parts, there are three parts: paper A, paper B, and the CAS exam. Paper A, any doctor who is registered with any medical council can take. Paper B, you need to have some psychiatric experience. Paper and the CAS exam, you need to have at least 24 months of psychiatric experience. So it's all explained on this link. If you go on the Royal College website and just search for MRCPsych, can I take the exam, then they'll explain to you that are you eligible and who is actually eligible to take the exam. So to answer shortly, if you are a trainee abroad, you're doing FCPS, MD training, India, Pakistan, you can take MRCPsych exam. There's no one stopping you. You can read those guidelines. So the common question I get usually at this stage, a lot of people worry about this, that somebody will ask me that I have done ST training, but bypassed the core training. So I'm only done technically my training in UK is only for 3 years. So will I get CCT or will I get Caesar? And this has been clarified by the GMC that now if you have done part training in UK, if you only done 3 years of ST training in UK, you will get CCT, not Caesar. So this is just to be reassured that you will, at the end of the ST training, you will get CCT. Now we'll talk about the MTI pathway. I think this is again suitable for experienced psychiatrists and psychiatrists, especially who are in training in their home countries. I think this is the spirit of MTI scheme. This is what they're targeting. Their ideal candidate, as they may call it, is the person who is in psychiatry training in their home countries and they want to come to UK for a few years to gain experience here. MTI is run by the Royal College of Psychiatry. There's a scheme there. There's a fixed timeline they follow every year. They take applications every year for MTI. This is a website. You can go on and have a look at that. So it's annual recruitment via the Royal College of Psychiatrists. And if you get selected for MTI scheme, you don't need to do PLAB. You don't need to do MRCPsych. You will get your GMC registration sponsored by the Royal College of Psychiatrists. And then you will also get a 2 years of rotational job, a post, and then Tier 5 visa. Just a technical thing here, the Tier 5 visa is not the same as the healthcare visa, which other doctors get, or Tier 2 called sometime as well, because Tier 2 or the healthcare visa will become nationality in 6 years. They become ILR in 5 years and nationality in 6 years, but Tier 5 visa doesn't become nationality. So if you want to stay in UK for long run, if you're on Tier 5 visa, you will have to find another different type of job after MTI. Then you can change your visa to a Tier 2 visa and then continue to work there. But I'll talk through that in a minute. Eligibility criteria for doctors who are going for an MTI. Now I've taken this screenshot from the Royal College of Psychiatrists website. Screenshot again, I'm mentioning this, taken in March 2023. This criteria might change for the future. This is valid for the upcoming MTI scheme, which is already in progress for the August 2023. They might change the criteria for next year. If you're watching this presentation next year, please refer to the new criteria. But it's quite simple. I think they explain it well. They expect you to hold a medical qualification, MBBS, basically, very simple, completed internship, which is not too complex. And then they expect you to have at least 3 years experience of working in psychiatry in the last 5 years. So they are basically asking for recent experience, including the 12 months leading up to GMC registration. So they want doctors who are in practice, basically. Sometimes doctors who have left practice and then they want to come back to practice, they might not be suitable for MTI. Then they will expect you to have the English level language competency exam in the last 18 months, the IELTS or OET. So now this is an important thing to understand. If you are aiming for MTI scheme, look at the timeline. Normally their application closes in January every year, but that timeline can change. Don't wait for the last date, then realize that you don't have you have everything else, but not the English exam. Get the English exam out of the way quickly if you are aiming for MTI in the coming year. Because then if you don't have the English exam and everything else, you won't be able to put in your application. Then they expect you, the doctor, to be a resident overseas at the time of application. Resident overseas mean that sometimes doctors are already in UK and they're trying to get an MTI. Like, for example, if somebody is a spouse of a doctor who's come to UK, husband or a wife of a doctor, and they say, can I apply for MTI? I'm depend on the spouse visa. But they are expecting doctors to be abroad when they are applying, not already in UK. Then But another important criteria is that you have obtained or working towards the postgraduate qualification in psychiatry. So if you've done MD in psychiatry or FCPs in psychiatry, you are a candidate. If you're working towards it, mean that you're already in training, then you obviously they will also consider you a good candidate. And then there are some other criteria you can read around that you shouldn't have unsuccessful attempts on PLAB registration in the past, and haven't failed any psychiatric exam in your training, and all of those things. You can read the other criteria, but these were the main criteria basically, that you need to pass the English exam, have already experience in your home country, working towards the postgraduate qualification, or done the postgraduate qualification. I mean, this is again a screenshot from the Royal College website. I won't spend too much time, but they are basically explaining here that what really happens after you submit your application for MTI to the MTI team. As I said, usually the last date is in January. The MTI jobs start in August normally. So you submit the application, Royal College shortlist you, conduct interview via video link. You don't have to come to UK to give the interview. Then they will identify the candidates who are suitable, match the applicants with the employing organizations, which are generally the hospitals or NHS trust or mental health trust. Then doctor apply for the GMC registration, and then they will sponsor the GMC registration. Then there will be ID check by the GMC. That's just a normal process and part of that. Then this certificate of sponsorship, which is a visa, basically certificate which issues, then you will be issued a visa, and then you come to UK for ID check and all this employing bodies check, and then you will start working on the MTI scheme. So this is just a process, basically starts with submitting application, interview, and then they will take it from there onward. So the common question I'll get here normally is about what is the future for MTI. So people will say, well, actually, I'll come to UK and spend 2 years of my life there. But what is the future? Have I got any future in UK? What will happen to my GMC registration at the end of it? What will happen to me after the end of it? Will I be kicked out of the country? Will I be jobless? Can I apply for more jobs? Can I apply for more visas? So first thing to understand, the GMC registration which you get with MTI is permanent. So your MTI post will finish in 2 years, but your GMC registration will not finish in 2 years. You will have your GMC registration permanent, that will continue and stay with you. Some people will think about returning back home. They might think that I have enough of UK. I don't want to work here anymore. I want to go back to my home country. I'll have better future there, or move to another country. That's fine. Sometimes people are in halfway through their fellowship or whatever they're doing in their home country training, and they would want to go back and finish that and then come to UK again. They'll go back to their home country as well. But then some doctors you will see while they are doing MTI, or even prior to doing MTI, they're already aiming to pass MRCPsych exam, and they pass the exam while they're in MTI scheme. They can get their certificate C sign as other doctors and apply for ST training in psychiatry. That is pathway a lot of doctors have taken, and then 3 years time they will become consultant in UK. Sometimes when you don't have MRCPsych exam, but you finish your MTI, you got your UK experience. Now you can actually apply for other jobs in UK at the end of your MTI, and then you can get a non-training grade job, a middle grade job, and work on that while you're still trying to sort of take other paths there. You can continue working in a non-training job, but you can do your MRCPsych, get certificate C sign, apply for ST training, or a non-training job. You can apply, consider doing the non-training route to become a consultant as well, Caesar route. So these are the available options for the future for MTI doctors, and this is what really happens to them. They either go back, they pass MRCPsych and apply for ST training, or they just continue to stay in UK, apply for non-training, get a great job, get a new visa, and by the end of their MTI. Now we will come to the sponsorship route. Now this is relevant for the experienced psychiatrists. Now this is not the same sponsorships as MTI. So MTI sponsorship is coming from the Royal Colleges. This sponsorship comes from the trust. I must say that this route is it's quite random. It's not as there's not that many vacancies around. But this is for experienced psychiatrists. Some trusts can directly sponsor your GMC registration. Sometimes you will see some trusts will advertise some international fellow posts. So these are international. The trust is asking for international doctors to apply for those posts, and then they will, once you have gone through the application process, they can apply for your GMC registration and then employ you on tier 2 visa. Occasionally, you can directly apply for sponsorship as well, and there are some doctors who are working through that pathway as well, which is very simple. Basically, if you're an experienced psychiatrist in your home country and you want to come to UK, but you don't have GMC registration, you don't have lab or MRC psych, haven't gone through MTI. So what you can do, you can make a good CV, then you can find out the trusts which can sponsor you. The name of the trusts are available on the GMC website, which I'll show you in the next slide. But basically, you approach those trusts, you approach the HRs, you can approach the clinical leads in those trusts, requesting that that you are experienced psychiatrist, you are willing to come and work there. If there's any vacancies, if there are any upcoming posts where you can be considered for sponsorship. So sometimes that you might find some place which may be able to accommodate like this. But again, for that kind of route, you might have to apply for hundreds of applications. You might have to wait for a long time. That might not be so straightforward, because this is not a specific pathway. You're just trying your luck in different places. But it has been done. People have got jobs. So this is the link. If somebody wants to read more about the sponsorship, the GMC website actually has a link. This is the website address. Applying for registration using sponsorship. So apply through sponsorship. You have to satisfy that you have a knowledge skill required to apply to work as a fully registered medical practitioner in UK. So each sponsor will have their own scheme. The same link will have the list of trusts which can actually sponsor you as well. There are some criteria. They expect you to have been working in the last in last 12 months. You need to be actively working somewhere as well, engaged in medical practice. Those sort of criteria you'll find on this website to see if you will fulfill that or not. I must say that out of those criteria, I've explained the common pathways for the senior psychiatrists: passing MRC Psych, MTI, or sponsorship. I would say passing MRC Psych is still superior pathway, because with MTI scheme you are still expecting the Royal College to find you a post. They might post you anywhere. You might post you in an area you don't like. With sponsorship, it's quite random. You might get a job randomly somewhere. You might not get. You might get frustrated about sending so many applications and not getting any response. Whereas MRC Psych is a superior pathway in a way that after that you get the registration during the English exam, and now you're free to apply, directly approach different trusts, and you have more freedom. You have a stamp as well that you have the psychiatry knowledge. You have a postgraduate exam that you can actually work in a middle grade job very easily in UK, and then you can directly approach the different hospital which you fancy working, different area you can fancy working. So you have more freedom with the MRC Psych route. This is what I'm just trying to say. Not so much freedom in MTI or the sponsorship route. Now there are a few more slides left just to explain some other concepts. So you have to understand, in UK, the doctors are working on two different parallel pathways, you can call them. So you have training grade doctors. They are very well specifically doing certain kind of training. Training grade doctors are generally employed by the deaneries, but they're working in hospital, and different trusts. Junior doctors in training are either foundation training, which is the internship level, core training in psychiatry, which is the junior level of training. Middle grade doctors in training are called ST doctors. So these doctors will have not just clinical supervisor, they will have education supervisor appointed by the deanery. They will have more support from the deanery. They will be attending a session to learn, formal sessions to learn new skills. They will have pathways to improve their skills. They will have annual reviews. But then on the side, you will also see in UK some non-training grade doctors working on the similar roles, but not having that much support. Sometimes, non-training grade doctors not always getting that much support because they're not under deanery, they're under trust, and trusts are quite random. Some trusts will be very supportive, some might not be. The junior grade doctors, non-training, would be SHO. They might be called clinical fellow. They might be called LAS, local appointment for services. They might be called trust doctors. There are different fancy names, non-training grade, and that might be the first part of training you do in UK. Sometimes this is the first job as an IMG you get, a non-training grade junior doctor. But then you don't stay in here. You actually try and get the core training. You come to jump on the training side, and then from core training to become mastery training doctor. But sometimes some people actually don't like the fact that they have to do training. They think training will mean that they have to move around a lot. They might have to do exams, and that might be stressful, do a lot of things. They might say that, well, actually, I'll just stay on a non-training grade. And once you gain more experience on a junior level non-training grade, you can apply for a middle grade job. And the middle grade job, non-training grade, they have many fancy names as well, but more commonly they're called SAS doctors, staff grade doctors, senior clinical fellow, for example. Again, they are not consultants yet, but they are above the junior doctors. They have some independent skills. These middle grade jobs could be just 9 to 5, flexibility in terms of working just one place, and they don't have to move around. They don't have to do night shifts and on calls and all of those things, which the training doctors have also almost always are on the on call rota and doing night shifts and weekend shifts and long days and all that. So Caesar pathway is basically, as I mentioned earlier, is for doctors who don't do formal training. They have taken the non-training grade jobs and they want to get on the GMC register to become a consultant. The Caesar pathway is basically for them. So it's not to be confused. Caesar, if you're talking about psychiatry, you cannot directly apply for Caesar from abroad. I've never seen a case where a Caesar applied from directly abroad. A Pakistani or Indian doctor have directly applied for Caesar from abroad and got it. So you have to come to UK and work for a few years. Can take up to 3 to 4 years. I've known only one doctor who's done his Caesar in 2 years time, at least 3 to 4 years, sometime more than that. So basically what Caesar is that you are trying to satisfy GMC that the experience you have and the qualification you have, when considered, the equivalent to somebody who has just finishing the ST training. So they are equivalent to the CCT level doctor. So if you can give that evidence to the GMC, they will have pathways to submit the evidence, what sort of evidence they're looking for. So this may require a lot of paperwork and evidence gathering, but I wanted to show you that there is a pathway. If you want to do completely non-training pathway, don't want to go on training pathway at all, you can actually utilize this. I mean, if you want to learn more about Caesar and how to get Caesar, you can go on the Royal College of Psychiatrists website. There's a Caesar link where they're talking about different criteria and how to apply. There are some deadlines, dates, and all of those as well. Caesar is, again, in psychiatry, Caesar will be, you can apply for subspecialties of psychiatry, child psychiatry, Caesar, forensic psychiatry, general psychiatry, old age psychiatry, LD, medical psychotherapy. Then a lot of people will ask, that what is the problem with Caesar then? Why wouldn't you recommend it, or what are the issues with Caesar? So if you got Caesar in UK, you will be on a specialist register, you will get a consultant post, and you will have the same respect and same kind of job as a consultant who has CCT. However, if you want to go abroad after you finishing your training, if you want to move to Australia, New Zealand, you want to move to Canada, Middle East, then what I hear, and I mean, I am not an authority on that move, but what I hear is that CCT and structured training is accepted well, and Caesar pathway is not that well accepted. They might ask you to submit more evidence. They might not consider you same class of doctor as a CCT doctor. So that's just if you are trying to move abroad from UK, just to consider that CCT may not get the same respect as a CCT doctor. So within UK, you can do the same job as a consultant, no problem. So the last, I think there's only 2 slides left, but this is another question people ask me that, what about MRCPsych? So when we pass membership exam, we get the membership of Royal College of Psychiatrists. How do we get the fellowship of Royal College of Psychiatrists, and what are the advantages of getting fellowship? So just to be clear, if you want to become a consultant, MRCPsych itself is not enough. As I said, you need to either have CCT or you need to have Caesar to become a substantive consultant, but you also don't need fellowship as well. So there are psychiatrists in UK who made brilliant career, senior psychiatrists and everything. All they have MRCPsych training, SC training, CCT, never had fellowship, and then they continued to work. So fellowship is actually not essential to get. But if you really want fellowship, this is the criteria available on the Royal College website. There is no exam for fellowship. You get fellowship by recommendation, by showing that you have served psychiatry well. You need to be MRCPsych for at least 10 continuous years or more, and then there are some other criteria, recommendation you have to submit. And then Royal College will look at individual application to see if you are worthy enough to get the fellowship. So fellowship is given to you, awarded to you by Royal College. It's not taken from an exam. That's just to explain. And as I said, also fellowship is not essential to have. You can still become consultant in UK, senior consultant, academic consultant, whatever you want to do without the fellowship. So just to summarize it all, and I hope this was useful presentation, the GMC registration is the first point to consider. So if you are an international medical graduate, looking to come to UK, looking to work in UK as a psychiatrist, think about the different GMC registration pathways and which one will be more suitable for you. Start working towards that. Junior doctors, lab is more suitable, more senior psychiatrists who have experience in psychiatry in the home country or who are training in psychiatry, MRCPsych is a superior pathway. Otherwise, MTI pathway, sponsorship route is also available. Then, as I said, several entry points are available. As I was explaining, you don't have to follow one singular pathway. If you have got the GMC registration, depending on how much experience you have in psychiatry, you can either start as a junior doctor, you can start as a middle grade doctor, you can start training as a co-trainee, you can aim to get the ST training, you can take the non-training pathway and aim for Caesar. Some people will aim for a locum consultant post, will need not even consider Caesar, and they will think that, you know, just working in a non-training post, they can get to the locum consultant post anyway. So why would they bother with all the other hassles? So, you know, entry points are quite different for psychiatrists, international medical graduates. You have to consider which one is more suitable for you and which more doable, which subspecialty of psychiatry you like as well. That will also be a big consideration as well. Non-training route, I've already said to you, an alternative pathway in progress in UK. So I think I like to just wish the very best for all of you who are thinking about coming to UK as a psychiatrist. The only last thing I would add that UK has shortage of psychiatrists. I think psychiatry is one of those specialty which will remain short of doctors for a number of years. And it's not just UK. You go around the world, the Western countries, the rich Western countries as well. America, which is one of the richest countries in the world as well, is also short of psychiatrists. Developing countries, the Middle Eastern countries are also always short of psychiatrists. So there's a scope. There will always be scope of international psychiatrists, international doctors coming and filling up that gap, which is left because of the shortage.